Hello, please don't mind the noise in the background. My roommate's doing his own work in the living room. I'm in the kitchen, obviously. The fridge is right behind me. I want to talk about something that I've been dealing with, pretty serious problems. Try and listen only to the sound of my voice. I'm Carol. Welcome to Reverse De-Evolution and my other channels. I want to talk about Medicaid. I believe that Medicaid should be a safety net for everyone, not just for people that are entitled to it, quote unquote. There's talk about something called single payer, something called universal health care, and even something called Medicare for all. But what do you think about, I'm going to give you a moment, what do you think about when you hear the word Medicare? The word I think about when I think about Medicare is senior. And some disabled people qualify for Medicare depending on their own case, individual case. I'm an adult survivor, so I have survivor benefits with SSDI and Medicare. And since I'm below the poverty line, I've still qualified for Medicaid, which is MEDI-CAL here in California. I used to have just straight Medicaid. I used to have just straight MEDI-CAL in California because I used to have SSI. And then around the time of my father's death, my aunt helped me get set up on survivor benefits. And survivor benefits gave me Medicaid and MEDI-CAL, Medicaid and Medicare together. Medicaid and Medicare together. And which made me a full dual eligible. Then my father passed away. And since I wasn't getting just benefits spinning off him, I qualified for full benefits off his retirement or his Social Security or his disability, probably his retirement. I'm not going to bore myself trying to figure out what all that means, but the end result was I still was able to qualify for Medicaid through my county, my local county. And for the past few years, for the past 10 years, I have had to renew my MEDI-CAL with the county. You're automatically renewed if you have SSI. If you don't have if you don't have just Social Security or just disability benefits, if you have supplemental security income, or if a portion of your government check is a combination, if you have a combination government check of SSDI and SSI, you'll still automatically be re-enrolled in MEDI-CAL every year. But now, since my father passed away, my benefits changed back in 2015. Or 2016, actually. Yeah, 2016. The summer of 2016, I had to enroll with the county and get hooked up with the state of California MEDI-CAL through the county of San Diego. And so far they've been all right. I've been able to renew my benefits without mishap until the unwinding period, the post-COVID. During the COVID pandemic, and I'm sure some Medicaid people fell between the cracks still. Maybe some people were still uninsured. I don't trust the system. They were automatically re-enrolling people in MEDI-CAL, including me. And there were a couple of years during the pandemic emergency where I did have to renew my benefits. But I didn't have any trouble until 2023. The summer of 2023, I had to go to the dentist because I had a dental emergency. I had a crack in this tooth here, and I had an abscess, which I didn't even know about, in a tooth up here. And I had to have a full dental exam, but I had to pay for it with my credit card because, according to the dentist, I was not enrolled in MEDI-CAL. And I asked the county. I called the county immediately and asked them what was going on. And they said, we don't know. We'll check it out. And they said that I had something on the records, but I wasn't enrolled anymore. And they didn't know, but the closest conclusion they could draw was, this was back in 2023, the closest conclusion they could draw was it was during the unwinding period. It was when the lockdown, so-called lockdown, ended, and they were reopening some offices and reopening business as usual and transitioning back to normal, where you had to re-enroll and renew and all that stuff. So I didn't have to go through a full re-enrollment because the county knew about my case, but I had to take a week, and in the meantime I had an abscess. I had to pay for it to get that taken care of, and I'm still out $900. And I probably could have had a reimbursement from MEDI-CAL, but my provider told me that wasn't possible. So I don't know who brainwashed who, but I ended up being out $900, and had to pay with my credit card, my maybe even some cash that I had put away, that I had some extra. I always have some extra, but I don't even remember what I had to do, but I had to pay for it myself. And then fast forward a couple of years after I got it reinstated. Fast forward a couple of years. I wanted to see if I could get into a managed special needs plan with MEDI. So I called a insurance broker, a Medicare insurance broker, and I got set up for a little while, maybe temporarily, with this special needs managed care plan with MEDI, until I found out that they don't pay for dental, they don't pay for full dental. I still have to pay out of pocket if I need a lot of, like extensive treatment or whatever. MEDI-CAL isn't paying anymore. I'm through this sub company, this sub insurance, Delta Dental, and I have no idea what they're like, but I had to call them and clear something up. Okay, what is the coverage? And they said something about, you'll be getting general dental exams, you'll be getting cleanings, you might be getting, I think they said fillings, I'm not sure. But if you need any treatment like root canals, etc., we don't cover that. And I thought, oh my God, I have a lot of dental work that I have to have done lots of times, or to check up on, because I have a lot of dental work already done, and some more extractions. I had to have more extractions on this side of my mouth, and MEDI-CAL did pay for those extractions because I was reinstated at that time. But when I was getting enrolled and disenrolled, I had to disenroll from the special needs plan because it didn't cover full dental. It just covered just a very, very small amount. Kind of maybe very much what's covered if you have just a Medicare Advantage plan. You have to pay a lot of it out of pocket. It'll cover exams and cleanings, and it might cover fillings, but it doesn't cover, I'm not too clear if it covers fillings or not, but it doesn't cover extractions and root canals, and that is something I have to have done often, or at least checked on. I had a couple of root canal teeth extracted. I had to have a cracked tooth fixed, and MEDI-CAL wouldn't have paid for, DentaCal would not have paid for that if I had stayed on that Delta Dental special needs plan, dental sub-company, dental insurance. So I got disenrolled. It was 2024 when that happened. It was the year 2024, and it was April or May, the month of May, and I got a call from Medicare. And they said, you no longer have your Medicare savings plan or your full scope MEDI-CAL. You don't have that anymore. So from now on, we may be charging you premiums. And I was really upset. And I called the county again and I said, what's going on? And they said, you do still have your benefits, I'm showing, but the state of California said that was a discrepancy. We think you have other coverage. And I said, I don't have other coverage. I just disenrolled from this plan, and I'm supposed to have just the secondary, the MEDI-CAL, the the MEDI-CAL part. And they said, no, we're showing that you have other coverage, and you need to send us a letter proving that you disenrolled and that you're with just regular Medicare and regular MEDI-CAL. So I had to go through that, and another week of non-coverage. I still had the Medicare, but I didn't have the MEDI-CAL again. So thankfully, I didn't have to have any work done, any dental work done, or any medical issues during that time. I was very healthy, but I was very upset. I didn't know if I was going to have to pay premiums, pay a premium for the next month. So I did a lot of phone calls, and I had to deal with that, like for that whole week in 2024 in April or in May. And I was getting over a cold at the time too. I was sick. I was getting over a cold because I was still going to a day treatment program. You know, thankfully they somehow were able to bill the insurance. I think they understood I was going through an insurance thing, and they were better than the dentist. They still treated me, and they understood what was going on. I told them, and but I was sick because I think I sat next to a patient a month back, and I got sick because I took my mask off and I got coughed on. So I was getting over a cold, and I was dealing with that. And the first time I got cut off my MEDI-CAL, I was still recovering from COVID. I had just barely recovered from COVID. And boy, my bout with coronavirus was better than that bout with MEDI-CAL both times. So then the third time, you know, fast forward to the present, fast forward to January of 2026. I got denied my Universal Lifeline service because they weren't seeing my MEDI-CAL. I was trying to enroll by the MEDI-CAL method, you know, the program method, and they didn't see it, and they had to cut off my phone. So I don't have my Universal Lifeline phone anymore. I have just one phone now. And then around that time, I was dealing with MEDI-CAL yesterday. According to them, I got it fixed. That was another glitch. They had downgraded me back to just my Medicare savings plan, which only pays for the premiums and deductibles with Medicare. The MEDI-CAL part does that. And Part B, care, and all that. So I didn't have any medical bills, thankfully. But I found out, to my chagrin, that I was cut off my MEDI-CAL for the past 6 months. I didn't even have full scope MEDI-CAL that I was supposed to have with my Medicare. I didn't even have that for 6 damn months. So AI is blaming, I asked AI about that. AI and the county are saying we're still going through the unwinding thing. I don't know when that's gonna ever end. Computer systems are even more confused than people are, and people are more confused than computer systems. I must have asked a lady yesterday 3 times, what is going on? Why did I get disenrolled again from MEDI-CAL? So the thing that I'm dreaming about is, I might do this. I might suggest that we tell our governments, we tell our state and federal governments, go to the look on the website of the Registrar of Voters, or look at a website, search who is your representative, your federal or your state representative, maybe even the county representative, I don't know, but your representatives, and say people are getting cut off their MEDI-CAL without even being told. That's the other thing that's getting to me. I didn't even get any notice of disenrollment in the mail. I didn't get any call saying I got disenrolled. Just roundabout calls, like that call from Medicare, and then that call from Universal Lifeline. We don't see your MEDI-CAL. And then that my dental provider is saying, we don't see your MEDI-CAL. We can't treat you. You have to pay for it. So, and I'm a U.S. citizen. I was born in Kansas City in 1967, And I came out to California when I was 3. I have had this safety net all my life, and it keeps on getting cut off over and over and over again. Why? Why is that happening? And I can only imagine what immigrants are going through right now. Documented and undocumented immigrants are going through right now. But I'm a U.S. citizen, and I'm going through this. I've had MEDI-CAL all my life. I've had MEDI-CAL since I was 5 years old. And I'm going through these changes. I'm 58, and I'm going through these changes. And I'm handling it, but it's an injustice. Really. Just imagine. Imagine something just falling apart and crumbling. I believe we should have Medicaid for all. We need health care. It's a right. It's a human right, and our peace of mind is a right. MEDI-CAL, Medicaid, health care is a right. It is a necessity. Even dental care. The teeth and the mouth are part of the body. That's a medical issue. If I hadn't had this abscess taken care of, thank God I had some money. But I'm out money. If I hadn't had that treated, it might have gone to my brain. I'm not kidding. Look it up. Dental abscess. Potential dangers. There was a man on a podcast that I listened to. He said he had to go in the hospital and have surgery on his face and on his head, because he had a horrible abscess and he almost died from it. I'm not kidding. He had to be intubated and put in intensive care and operated on a few times to get rid of that infection. It was a really bad infection. It spread in his head, his skull. It might have even gone to his brain. So if anyone cares at all, like and subscribe, and talk to your representatives. And YouTube and Google, for God's sake, stop hiding my videos. Lives depend on it. Save MEDI-CAL. Enact some safety rules and safety laws for people who have their benefits. Their benefits should be cut off only at the expiration dates. For God's sake.